I'm a licensed mental health therapist that's embedded actually in the police department. I have a police radio, so when I hear calls come in that have a mental health component, I'll actually self-dispatch and meet officers right there and co-respond with them to the call. I'll help assess that individual, see if they need to go to the hospital or if they can be linked to some outpatient resources, and I'll help link them with those resources as well.
The main thing is if they need help with like housing, or if they're needing help with pantries, or if they're needing help with finding jobs. We've had calls where like they refuse the therapy, they refuse community support, but yet still that gut feeling that this doesn't feel good just leaving this. I'll say, how about you have Nancy, one of our peer supports, call you, because she's actually have a lived experience that she can help you and she can give you support.
We actually come from that place of walking in the shoes of the individuals that are struggling currently with substance abuse or mental illness. They will open up if you just make them feel comfortable, know that you're not judging, that you're really coming from that right place, and you want for them to have that opportunity, if they would like, to utilize some of the services if they're ready.
The free stabilization for 90 days is the free therapy that's paid for by Region 6. Some people who come in and come for those every week for those 90 days, they really do make progress. But if some of them, if they're at that point where they're like, I want to explore more, I want more therapy, we refer them to an ongoing therapist who will do the therapy until they're done.
And I always hope that if they just take that first step, they'll start running. But that's always up to them. And no matter if they come back the next time and it's the same conversation, we'll talk.
To me, the police are more than a police officer. They're an extension of Lutheran Family Services. And it's for all counties that we work with. I don't want any police officer to be a stranger, and I will work very hard to make sure that doesn't happen.
The program's saving lives. We have therapists on scene who are trained to ask the right questions. We have people, our peer support, who's following up with people, asking them how they're doing on a regular basis. And then we have our post-crisis therapists who are getting them to a place of stability. So that, in the future, if they do have suicidal thoughts or, any kind of threat, that they're better able to handle it and they're better equipped.